Why is this being withheld from any child or any person dealing with seizures?
A passionate plea from a former Liberty Township family to legalize medical marijuana. Their 4-year-old daughter, they say, desperately needs it to curb her epileptic seizures.
Good evening, everyone. So the Benton family did something really drastic. They picked up their entire Liberty Township home and they moved to where pot is legal, Colorado.
So we took a trip to see if the new treatment is working and what medical experts have to say about giving a toddler medical marijuana.
It has been a very stressful move. Our families are really upset. Our friends are really upset.
Heather Benton, her husband Adam, and their 4-year-old daughter Addison are living a bit like outlaws, although they are doing nothing illegal.
Let's go.
This is their new home in Colorado. They've been here 2 weeks.
Once we got out here, it was just a relief.
Addison has hundreds of seizures each day. She's on all sorts of medication,
Do we need a couple patches?
including at least one from this pot dispensary in Colorado.
We'll take and switch the Charlotte's Web with this.
Here they are purveyors of all things pot, including a patch and liquids that contain cannabis, which Heather and Adam are banking will help stop their child's hundreds of seizures every day. This is the patch of, well, pot. They put 1/8 of a patch on their daughter's leg twice a day. It has THCA, a marijuana compound, in it.
THCA is non-psychoactive, so it's not getting anybody high when they use it.
And the results?
It's been fantastic. Her seizures have gone from hundreds to, the other day I think it was 19. We were down to 19.
Can we give her kisses?
Addison is 4, but because of her seizures, she's never had a chance to start learning, developing, and acting like a toddler until her parents say, now.
Before, she always walked like she's drunk. We noticed 6 hours after we put that on her, she wasn't falling down. Started saying new words within 6 hours. It wasn't like yesterday. This was 6 hours after we put this patch on her.
I spoke with Dr. Michael Privatera. He's the director of UC Hospital's Epilepsy Center. He says he understands families making these decisions. He also thinks medical marijuana may have some benefits, but he feels strongly that it needs to be tested, not just for its efficacy, but for its long-term effects.
Not every marijuana-based medication they've tried has worked.
All done.
But so far, the patch has. And all the questions, the judgments, the cross-country move fade away.
What's your name?
Good job.
You ready?
When it comes to their little girl's health.
Pushing through the 20 hours in the truck, was all worth it when we put that patch on and instantly saw a difference. She lit up, her face lit up.
Dr. Privatera says at least 3 of his patients plan to move to Colorado for medical marijuana. He says at least a dozen more are seriously discussing it. UC Medical Center and Children's Hospital will begin medical marijuana drug trials beginning this summer. Now, right now on WCPO.com, you can see this Weed Revolution page. It's an entire page dedicated to the marijuana debate, including the investors trying to cash in on a new crop.